everyone, and welcome to the pharmaphorum podcast. I'm your host, deep dive editor Eloise McLennan, and this is another episode in our special series celebrating 10 years of Frontiers Health, a decade of bold conversations, innovative thinking, and global collaboration. Today, I'm joined by someone who's become a bit of a fixture at the heart of the event, which is Jess DaMassa. If you've been to Frontiers Health over the past few years, you'll know Jess as the dynamic onstage host, interviewer, and moderator who helps to shape and guide the conversations happening live at the conference. But beyond Frontiers, Jess is also known for her work across the broader healthcare landscape as the founder and host of WTF Health, interviewing top pharma and health tech leaders and bringing insightful storytelling to the world of life sciences. Jess, welcome. Thank you for taking the time to step out from the other side of the mic and join us as a guest of this interview.
Eloise, it's a pleasure to be here. And fair warning, I am a much better interviewer than I am a guest. So you're gonna have your work cut out for you here.
I don't believe you for a second, but let's start with a quick introduction. For anyone who might not know what you do outside of Frontiers Health, can you give us a bit about your background and the work that you do?
Yeah, so I think you really summarized it very well. I don't know what else I can add to that other than I like to say I'm a health tech gossip. So I like to go and have conversations with people. I'm ultra chatty, very high energy, very optimistic on this space. And I literally love to talk to everyone everywhere about the future of health. So like you mentioned, I have my video interview series, WTF Health. I've done over 1,000 interviews in 8 years for that show. And I continue to talk to people mostly about healthcare technology trends. So what are some of these big macro forces that I'm hearing through all the chatter? I try to synthesize it and then talk to other people in the healthcare ecosystem who may not, be paying attention to the digital health, the technology, the innovation stuff on a day-to-day. I try to get them smart real quick on what's going on that will likely impact the way that they're delivering healthcare in the next 3 to 5 years.
You mentioned that you've interviewed thousands of people across the industry. When you're going onto a panel, when you're going on to moderate with people of different stages of their career from different backgrounds, how do you go into prepping for those kind of interviews to make sure that everybody is on the same level? Not everybody's as upbeat as you are, not everybody's as confident as you are. How do you go about running those sort of panels?
Okay, I feel like one of the greatest strengths I have is curiosity. I'm just a curious girl. So it's like I really just try to think about what the audience, whatever the audience is for the event, might want to know. Like, what questions would they ask? And I always try to adopt the mentality, like that whole old idiom, like, there's no dumb questions. Like, I try to really live that because I think a lot of times in healthcare, people will over acronym. They will try to talk over what's going on. And then in technology, that adds a whole other layer. Somebody starts talking to you about algorithmic integrity and this and that, and people's eyes immediately glaze over. So I actually think back to one of the first healthcare jobs that I had, which was at a Blue Cross Blue Shield healthcare plan here in the US. And my job was on the innovation team. And one of the things that I found really quickly that I would have to do is talk to these senior level executives who really knew healthcare. They knew the business of healthcare. They knew about coverage. They knew about patients. They knew about the medical side of things. But one of the things that they didn't really feel comfortable with were these new ideas as far as new business models or the new technologies that were coming in place. And in these big meetings, they were afraid to raise their hand and ask questions like, I don't understand how artificial intelligence works. Can you explain it? Terrified to ask that. And so they'd make these sidebar secret meetings with me to have me come in and explain how this stuff works behind the scenes. And so I still think of that when I prep for panels or interviews or fireside chats, because I think to myself, how can I make sure that we're all starting at the same place by maybe asking some of these questions that people are too afraid to ask, starting there and then building on that so that we can all go together deeper into the conversation and really understand what's going on. Because I think there is this general sense of curiosity that people bring to a conference, to an event like Frontiers or wherever they're at. They want to learn. And so I just feel like if we can approach these one-on-one or these panel conversations with that mindset of okay, everybody's here to learn. How can we excavate this information and these stories so that people are grasping, the key takeaways that the panelists want them to take away? and bring home and integrate back into their day to day when it comes to running a healthcare business. That's like, I feel like that's the aim for me. And so I set everything up to try to do that.
So I think we can add idea translator onto your resume as
Okay. Well, I try to like tie it all together and connect the dots, which is hard sometimes, which is like for me, I love that challenge because I try to keep like a high level view. I like to say I know just enough about all of it to be dangerous, which means like I can ask like the hard question, but I'm also trying to connect the dots for other people to see if I can help them reach some of those conclusions or at least get them to a point where they're like, the light bulb has turned on. I see it. I can totally take this now and figure out what it means to me and what I'm doing in my job.
and you've been involved with Frontiers for did you say 9 years now?
Yes.
That's incredible.
It's crazy. I am from Frontiers number 2. That's where I got brought into the loop. I was the original host of the interview lounge there. And it was one of the best experiences I've ever had. And truthfully, I'm going to take the opportunity to thank Roberto Ascione and the healthware team and everybody who helped put together Frontiers, especially in those early days, because my involvement with Frontiers actually predates me developing WTF Health by 2 years. So I really got my start as an interviewer working at different conferences, and Frontiers was the third conference that I was an interviewer at. It was the first international conference that I was an interview at. And it was just such a tremendous experience. So like formative years of Jess, Frontiers is a big part of that. And I feel so lucky that I've been along for the entire ride.
So you've grown up alongside the Frontiers Health Conference. What attracted to you at the conference in the first place? And then what do you see now that makes the event stand out, especially compared to other conferences?
Okay, so luck attracted me to the conference in the first place. I was at Health 2.0, which no longer is around as a conference. Back then, this was Matthew Holt and Indu Sabaya's baby. That was like really the first ever digital health conference. And they had the US conference, European conference. They even had it in Japan a couple times. And it was a movement, and it was like where you went in the early days of digital health. So that was my second time doing interviews. I was there at Health 2.0 and I met Eugene Burakovich, who at the time was the head of digital health for G4A at Bayer. And he's like, hey, we're sponsoring this new conference in Europe and we'd love to have you do interviews there. Come on. And so it was lucky for me, ran into Eugene, who knew Roberto. And so that's how I got brought over in the first place. And what has attracted me to the conference since, and this was awesome because I've experienced this the first time back in 2016, and I continue to experience it. And when I'm talking with other people about attending Frontiers, I always say this. I just think from an innovation standpoint, it's really hard to do innovation because it's like, especially in healthcare, there are so many constraints. And so one of the things that innovators will do if they're trying to develop a new business model or, apply technology in a way that is novel is that they'll try to well, what would it be like if the constraints weren't there, this one or that one? And I feel like when you change the conversation from a US-based, US-focused conversation and take it into literally another country, another health system that operates completely different from the way that the US healthcare system does, some of those constraints that you can't imagine not being there, like the payment model, for example, it's different. And so you get to see how different technologies, different models play out in that different kind of pool of constraints. And I think that it only, even if you're like, well, I can't bring that back to the US as it is, I feel like it gets the wheels turning on how you could, because it's like, it takes your imagination to that place, where it's like, okay, if the constraints were different, well, the constraints in Europe are different. The constraints in Asia are different. Same in Australia. I mean, they're just different. So you can really, it's almost like a living laboratory of watching how some of these new solutions, technologies, models can meter out and what you can take back to your home country with that, I think is really important. So I've always appreciated hearing what's going on in the European space and in other places abroad, because I think that it just helps understand some of the fundamentals about what patients want, what clinicians want, what the market wants. And you can take that back into any health system, wherever you are in the world.
And do you have like a favorite memory or a favorite panel, favorite discussion point that you've heard from your, again, 9 years for Frontiers Health?
Oh my gosh. I'm going to give you two real quick. So the first one, like where I just thought this was the coolest thing, and I think nobody else will bring this up. So one of my favorite memories from the early days is 2018 when the CEO of Proteus, remember Proteus, where it had the little sensor that they embedded into the pill and they had a partnership with Otsuka. Anybody who is OG digital health is probably dying laughing right now because this was like the biggest deal when it happened. And then things subsequently did not work out. But it was just it was one of those moments where you really felt like, okay, our industry is being taken very seriously. This is a major partnership with a big pharmaceutical company. And there was just so much promise. And the things that happened in the years that followed didn't net that out. But it was still like, there's like these moments throughout the last 9 years where it's like, ooh, things are changing. And it's like, you get a sense of like where the tide is at in terms of the greater healthcare ecosystem and where digital health fits into it. Another one of those moments for me was in 2020, a hybrid virtual and in-person conference. And I was part of the virtual because we were still unable to travel for COVID from certain places. But that was one of those moments where we really felt like, okay, like all of these digital health applications, telehealth, it was like, this is now things that everybody is talking about, not just us in this little population of people. And then I would say like the next little pearl in that string of pearls is this, and Steve Sentence mentioned this in his episode, but it's one of my favorite memories, is this mega panel, I call it, that we had and this was 2 years ago, 2021. And mega panel capped off the plenary session. And it was kind of a surprise because I thought I was just going to be talking with Roberto about like, let's look forward a couple of years. And instead it turned out to be a 9-person panel. Surprise! With literally like everybody I had known from the beginning of Frontiers to that day. And it was just surreal for me to sit there and look across the spread of people, 7 of whom were in person, 2 of which were virtual. I mean, people like Matthew Holt, Unity Stokes from Startup Health, Megan Coder from the Digital Therapeutics Alliance, Pierre Laurent, who had the first ever digital health company to IPO in Europe. I remember that. And then he, like at that event, I think, or the one before it, they had been acquired by a bigger company called Aptar. I mean, who else was on that? Steve was there himself. Eugene was there. I mean, there was just so many people who were like just formative in terms of moving the industry forward. And I'm looking forward to seeing what we have in store for people on stage to celebrate the 10-year, because for me, that was one of those moments where it was just surreal, like how much work these people had done to help advance the industry, and from different angles, from the policy side, from just ecosystem development, from, supporting through pharma or supporting through being a startup that was successful. I mean, it was just really a wonderful moment to kind of like bring it all together. And so, yeah, I mean, to answer your question, I have too many great memories of Frontiers.
It was a bit of a class reunion panel. I'm really interested to see if 2021 was the class reunion panel. What are they going to do for the 10-year anniversary?
Oh, right. It was kind of an accident. So yeah, I'm excited to participate in some of these, like, the 10-year. I mean, that was like, if we were ramping up for it with that panel, I think that this year to celebrate the official decade of the conference, we're going to have something very special.
Have everyone on stage, all of the audience. Okay, so we've talked a little bit about what you've seen from previous years and your favorite memories, but I'm interested as the host coming into it for another year, the decade, what themes or focus areas in health innovation are you particularly interested in? What are you following right now? What are you really interested in seeing debated or talked about at this year's event?
Oh my gosh, it's so funny that you asked that, because I feel like we are coming around on some of the themes from the very beginning, but in a completely different way. And so the best example I can give you of that for me is I'm very interested, like I'm sure so many people are, especially in the US, about GLP-1 drugs. And so what's so interesting to me about this, though, in the context of Frontiers, is that like when Frontiers started, when I was talking to you about Proteus, there was this whole conversation about digital therapeutics. And it was like this big debate that went on for years at Frontiers about like how digital and pharma were going to work together. And so it's like, is it going to wrap around the pill? Is it going to be alongside the pill? Is it going to be instead of the pill? Like there was like this whole thing. I mean, there were actual sessions about this, like around the pill, pharma and digital. Like this was like such a storyline early on. And yet I think that where we're at with GLP-1, we are kind of finding ourselves back there, but in a different way. I mean, these drugs are game changing. I mean, the things I'm hearing, like just from the gossip that I've got is, certain circles are calling them, as transformative in healthcare as penicillin was. And I'm not sure I go that far, but I definitely think they're going to change the way that we in healthcare think about chronic disease, how it's managed, the economics of it. But it's like, it's interesting because where are we at in the conversation? How can we wrap a digital component around it to assist with the behavior change? So you see like, companies are like Noom or even companies that are not specializing in GLP-1, like Omada Health, which just went public. I mean, how are they working around this and trying to support the patient with some of those behavior change things digitally using all that great tech that nudges and tracks and all that stuff? How are they using that to support the actual pharma intervention? And it's like, we have been talking about this for a decade with just different use cases. And so maybe this is the use case that works.
I've got to say, it's the place I've seen the most excitement in recent times. We think about healthcare. Healthcare is massive. You don't have this diversity of different applications in very many industries, but it's very rare that you get a single drug or a single sort of indication where you get people cardiovascular, people who are working in obesity, people who are working in neurodegenerative disorders, all coming together and getting really hyped about not just a drug, but also, as you say, the digital platforms, the beyond the prescription. How do we manage adherence? How do we manage side effects? How do we keep these patients supported after we've gotten that initial diagnosis, that initial prescription? So I think you're right there. That's something I think we're definitely going to see talked about this year.
And then alongside that, I'm really hot on how GLP-1 is like an example, not only for like digital plus pharma, but also like here in the States, how it's playing out as far as what it means, what it's showing us about the healthcare consumer. Because the majority of people in the US are paying out of pocket for these drugs, some percentage of the cost. And they're anywhere from $1,200 to $1,800 a month. And you're meant to be on them for a very long period of time. And yet I think the statistic I saw from Kaiser Family Foundation, and this was from 2024, is like something like 76% of Americans, 3 out of 4, are paying some part of that out of pocket, with like 20% or so paying the entire cost out of pocket. So I think, that coupled with here in the US, more people are paying out of pocket higher deductible health plans. A lot of people are carrying healthcare debt. As people are more in charge of their dollar, how are they going to be spending it? And so I think it's interesting that we're seeing like, I don't know, Eloise, I went down this rabbit hole of like reports on like consumer distrust of the healthcare system and like, the Rock Health reports on like how digital is being used and like digital preference for consumers, or like the Edelman has a trust barometer survey. And it's like overwhelmingly healthcare consumers, at least in the US, are very dissatisfied with the state of US healthcare. I mean, the number that I keep hearing, I've seen this in several keynote talks, and I've got it in one of mine, is Kaiser Family Foundation says that 44% of Americans would say that healthcare in this country is good or excellent. 44%, which means that 56% say that it is fair or poor. 56%. So there's a lot of dissatisfaction. And I think that patients are trusting their doctors less. I think that it's interesting what we're going to start seeing we're already seeing it with Gen AI. I mean, people are asking ChatGPT for medical advice, but beyond that, people go to social media. Reddit is huge in terms of being a source for where patients find healthcare information. And I've come across a statistic that's from the Edelman Trust report that says that as many as 1 in 3 people agree that somebody who has done their research on a healthcare topic knows just as much as a medical professional. 1 in 3. That's a little bit scary. And when you couple that with something like 85% of Americans will go to social media first to find out, to ask questions about what to do about a medical condition. I mean, we're starting to get in some dangerous, like, do-it-yourself healthcare here. And so I think couple that ethos of like, I know what's best for me. I know how to find healthcare answers. I trust people like me that I see on social media. I trust what ChatGPT or open evidence is telling me if I'm querying that. I think that this DIY sentiment coupled with this increasing comfort with technology like telehealth and like these Gen AI tools, and then also that dissatisfaction with healthcare and the fact that people are paying more out of pocket for it in the US, I think that that's going to have some real big market implications down the road. So I've got my eye on that whole consumer space too, because I feel like we're starting to, we've talked about healthcare consumerism for years, but I really think that now that people have to pay more, you're seeing like, hey, if the outcome is something that I really want, like to, eradicate a chronic condition or to lose weight, I'm willing to pay for it if I'm going to get the results that I'm looking for. And I'm willing to go outside the traditional healthcare system to find it if I need to. So I think that there's just this is just an interesting time. I'm hopeful it's an interesting time. We start to see some new innovations around that.
I completely agree. It seems like we're at or approaching a bit of an inflection point in terms of direct-to-consumer advertising, for one. As you say, the way that patients and consumers use digital technologies to find their own solutions, and almost that Amazon introducing the review section.
Yeah.
I think that's going to be a really interesting point that we'll probably hear quite a bit about at Frontiers is, as you mentioned, the peer reviews, but within the patient population. Of you would trust your peers more than you would trust the professional. I think that and the information, sort of the misinformation that you get online, the information that you can get online, and trying to navigate that new normal, really, where people are so comfortable with getting information, medical information online. I think you're really on that. And I've also followed you down that rabbit hole. I believe many people, many of us have followed you down that rabbit hole at least once in our lives, if not more. But
yeah, and so we'll have to talk more about it at Frontiers because I would love to hear more about what I'm resisting the urge, Eloise, to like interview you and asking what you're seeing in like the UK. I'm resisting. So I won't ask you until I see you in person. And anybody listening, if you want to talk to me about any of this stuff and come down that GLP-1 healthcare consumer rabbit hole, find me. I'm easy to find.
I will say there is no one more fun to talk to about this stuff than Jess, because as you say, you are the healthcare gossip in terms of you go up to Jess and you ask her about something and she's like, oh my goodness, have you heard about this thing? And it's that kind of ethos that I think that we really have at Frontier, is not just this idea sharing, but an excitement, a buzz around the idea of sharing those ideas. And I want to just get on to, there are lots of people returning for the decade anniversary, but a lot of people who are also first-time attendees. So as what I would say, if Roberto is the face of Frontiers, I would call you the voice of Frontiers. So as the voice of Frontiers Health, what advice would you give to someone who's attending for the first time?
Well, first off, I want to say welcome, thank you for joining us. And the advice I would give is, I think just like chat with us. Like, don't be afraid to speak up. Don't be afraid to introduce yourself. Say what you're doing there, what you hope to learn from the conference. Ask questions, meet people. Like, don't be afraid to, put yourself, even the smallest step forward towards like stepping into our community. We will envelop you with like open arms, like a big warm hug. I mean, truly, I feel like this community from the very start has been so inclusive of any kind of person with any kind of idea, any kind of dream, no matter how crazy, of changing the healthcare system. And we love innovators and we appreciate them, are enthusiastic about what they're bringing to the table, whether it be a new solution, a new idea, a route to funding. And even those who are maybe coming from an institution like a hospital system or a pharma company who are like, I don't get exposed to this stuff enough. I just want to hear. Just chat with us and talk, because I think that's really the best part about Frontiers. the stage presentations, the content is very well curated. But honestly, for me, I find it to it's conversation starters for all the stuff that happens over espresso and aperitif elsewhere in the agenda. So yes, please don't be, my advice would be, don't be afraid, speak up, come introduce yourself to somebody. I'm very friendly. So is Eloise. And meet some people, because that's really the benefit of having this group of people pulled together around these topics, is to advance the conversation. And you can't advance the conversation if you don't speak up.
Absolutely. Get involved in the conversations. We're all very, very approachable. And I don't think there's anybody at Frontiers that is not an approachable person.
No. No, everybody loves talking about this stuff. So at whatever level, like, pick a topic.
Now, I could talk to you pretty much all day about every topic that we had to discuss at Frontiers, but we have to arrive at my final question for you.
Oh, okay.
Which is the one that we are asking everybody in this series, which is, if you had to pick one word or phrase that in your view captures the future of health, what would that be and why?
The whole future of it, or just this particular era?
I don't make the rules. You decide what does your future look like.
Wait, I'm going to Taylor Swift this then, and I'm going to go with era's answer. Okay, so I feel like we went through a digitization of like paper things era way back, and that blended into then a digitization of experiences era, where I feel like, started with telehealth and then morphed into that digital health kind of world. And now I feel like we are entering our algorithm era. So I would say algorithm is the word to define the immediate future of health right now. It's going to be algorithm. I think that hopefully we are finally at a place where health data is clean enough, interoperable enough, because those are topics that have been of discussion for, again, the entire decade of Frontiers for sure. And I think even before that. But I hope that the data is good enough now where we can start seeing the promise of technology in terms of helping use that data to find those little nuggets of insight that really help make a difference in terms of providing really great care and improving outcomes, improving the day-to-day of clinicians through ambient listening and scribing technology. That's really exciting right now. And I think, for patients, maybe democratizing some of this health information and making it maybe not the place where they go to ask medical questions per se without a doctor, but a place to maybe go and ask those questions they're afraid to ask in the exam room, or that they forgot to ask, just to get a little bit more clarity around some of the things that they're hearing, so that they can better take care of their health. So yes, we are in our algorithm era, Eloise. That's where I think we're at right now.
I think those algorithms, data, interoperability are going to be three of the big words that you can put on your Frontiers Health bingo card for this year. I don't think we could have a Frontiers Health conference this year without mentioning algorithms, data, and data interoperability, because they are three of the biggest topics.
All right, challenge, Eloise. We're going to make a bingo card, and we're going to put all the words that we think are going to be on it. And then in 10 years from now, at Frontiers Health 20th anniversary, we'll look back at our 10-year bingo card and see if the words are the same. And it'll be a way to measure how we've done.
I think that is a great idea. Well, Jess, thank you so much for joining me, and not just being part of this conference, but for everything you bring to the Frontiers Health stage year after year. That's all for today's episode in our Frontiers Health Anniversary series. Stay tuned as we continue speaking with the voices behind the event, well, past, present, and future, all leading up to this year's special 10th anniversary edition in November. We'll see you in Berlin.
Hi, thanks, Eloise.
That concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments, at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your podcasts. Just search for pharmaphorum and follow and hit subscribe. Of course, don't forget to visit the website itself, where you can sign up for daily and weekly news and analysis bulletins, and follow us on Blue Sky and LinkedIn at pharmaphorum. That's PharmaPhorum. That's all for now. Thanks for listening.